The Baby Friendly Hospital Initiative is a global program launched by the World Health Organization and the United Nations Children's Fund to encourage and recognize hospitals that offer excellence in mother and infant care with the goal of achieving optimum feeding outcomes and early family bonding. The Breastfeeding Hospital Initiative assists hospitals in giving mothers the information, confidence, and skills needed to successfully initiate and continue breastfeeding their babies or feeding formula safely, and gives special recognition to hospitals that have done so.
The Baby Friendly Initiative involves encouraging immediate skin-to-skin contact with mom and baby. This contact helps to calm the baby, helps to regulate the baby's temperature, and also helps to calm mom and encourage mom to bond with her baby after delivery. Additionally, we see that women who breastfeed their children are more likely to return to their pre-pregnancy weight. So this is definitely a benefit for our active duty moms who are looking to get back to their fitness after baby.
The 10 steps to successful breastfeeding consist of evidence-based practices shown to increase breastfeeding initiation and duration. Have a written breastfeeding policy that is routinely communicated to all healthcare staff. Train all healthcare staff in the skills necessary to implement the breastfeeding policy. Inform all pregnant women about the benefits and management of breastfeeding. Help mothers initiate breastfeeding within 1 hour of birth. Show mothers how to breastfeed and how to maintain lactation even if they are separated from their infants. Give infants no food or drink other than breast milk unless medically indicated. Practice rooming in allows mothers and infants to remain together 24 hours a day. Encourage breastfeeding on demand. Give no pacifiers or artificial nipples to breastfeeding infants. Foster the establishment of breastfeeding support groups and refer mothers to them on discharge from a hospital or a birth center. Commitment to our mothers and infants begins the moment an expectant family steps foot into Belvoir. In our clinics, families receive care focused on providing them with information and resources necessary to make decisions about how to best feed and care for their child. In our delivery suites, our trained nurses and providers work to integrate the desires of the family with excellent medical care, promoting early family bonding through skin-to-skin contact, as well as breastfeeding regardless of the delivery setting. The first days of life are spent in the postpartum, where mothers and infants room together and the staff is trained for every parent feeding decision. Neonatal care is no exception. NICU parents, surrounded by the support of their care team, are encouraged to be active, hands-on participants in decisions regarding their child's care. The Belvoir Hospital continues its commitment with combined obstetric and pediatric appointments, as well as drop-in visits with our lactation consultants. There are designated breast pumping rooms to assist staff and patient mothers to maintain their infant feeding practices. We recognize the unique occupational challenges of service members returning to active duty and have developed special programs to meet the needs of all moms, even those breastfeeding in combat boots.
It's been proven that skin-to-skin in the first hour of life promotes the ability for mom to be able to breastfeed. It promotes bonding between mom and the baby. Exclusively breastfeeding for the first 6 months of life without any formula will help to reduce the baby's incidence of asthma, diabetes, and obesity later on. Mom's breast milk uniquely has antibodies that help fight off viruses and bacteria, and we see that babies that are exclusively breastfed have fewer rates of respiratory illnesses and diarrhea.
At the Belvoir Hospital, we are committed to providing an extraordinary patient experience to all that we are privileged to serve. The Baby Friendly Hospital Initiative isn't just a maternal child initiative, it's a hospital initiative. Accreditation demonstrates our staff teamwork, competence, and commitment to providing the very best care to our community.